So I'm a board certified psychiatrist and have helped over 260 PMHNPs gain clinical confidence in their psychiatric diagnosis skills, treatment skills, and helping their patients get better and improving their own income. So in this video, I'm going to be talking about how you can master psychiatry with your subconscious. So I first got this idea when I heard about surgeons, and what the master surgeons do, or some of them, is that when they dream, they've learned how to lucid dream so that way they can practice surgery in their sleep. And so then it's like it gives them all this extra window to improve their craft. And I was like, is there a way that I can start really getting better at psych rather than just purely just sitting down? And in fact, I recently had this experience where I moved in with my parents for about 2 weeks because I wanted to really focus in on my business. And so when I was there at my parents' place, the only thing that I did during my day was I would wake up, I would work, and then later in the evening, I would go to the gym, and then at the end of the day, I would watch some TV. And that's it. Like, that was my routine straight for about 2 weeks. And what I noticed was that all of my thoughts were on my business. So I'd wake up and think, okay, what am I going to do for my business? When I would drive to the gym, I'd have a podcast or some like business like lecture or something playing. And then I was thinking about the gym. When I'm at the gym, let's say I'm walking on the treadmill, I might be listening to something, or even if I'm not, I'm just thinking, okay, what can I do with my business? Even as I go to sleep, like I would think, okay, what am I going to do with my business? What next steps am I going to take? And then I would wake up and then have new ideas. And so this really gave me the idea about aligning my whole life to whatever goal I want to set. And so that's the wisdom I want to impart to you. So how can you do this? So the mindset that you need to have is alignment. If you want to master psychiatry, your actions need to be aligned with this. So your mind plus actions. What does this mean? So just as I shared that when I was working on my business, obviously my actions were aligned with it, but my mind was too. Like, that's the only thing that I was thinking about was, okay, what am I going to do with my business? So it's like my subconscious was making progress towards it, even though I wasn't doing anything business related, like when I was at the treadmill. I also had this realization when I was in my consult-liaison rotations in my residency. So that was the busiest time of year that we had, was consultation liaison. And so I had this routine going where I would wake up at 5, then I would go to the gym in the morning, and then at 8 a.m. I would be there at the hospital. And then the consultation was from 8 till 5. And so we'd do that rotation. And then afterward, I would go home, maybe like chill for a couple hours, go to sleep, and then wake up again and do the same thing. And since this was for 2 months, I found myself getting really locked into this. And all I was thinking about was psychiatry. I would be playing psychiatry podcasts on the way to work. You know, obviously during the clinic when there was downtime, I'd be reading stuff, I'd be researching things, I'd be looking stuff up in books. For example, like every time I saw a patient, I would be researching that. And so it's like my mind, I would be discussing cases with my supervisor. So all of my mind was aligned towards this. And I feel like that would help me make such good progress. I see other clinicians out there, other psychiatrists, other doctors, other healthcare providers who treat it like a job, like they will clock in, do the bare minimum at work just to get through. And then like as soon as like whatever time hits, they're out, they're done. And like, you know, that's fine if you want to be an average provider. But if you want to become an outstanding provider, then you have to align your mind and your actions towards this goal. Like, I want to master psychiatry. If you think about the best athletes, the best actors, like when an actor or actress is filming for a movie, that's when they go all in. They learn the role, and then like they'll cut out all the distractions, because like, you know, filming might be like a couple months of just intense shoots back to back to back. So it's like their whole mind, everything is just consumed around this acting. And then when they're done, of course, then they're done. So it's a similar concept here. You want to make sure your actions are aligned. So how can you start doing this to get your subconscious in? It starts with your patients. So what you want to do with all of your patients is reflect on them. what does this mean? This means that every time you see a patient in the clinic, in the hospital setting, you want to reflect on, okay, what problem is this patient having? What is their diagnosis? What's the reason they came in? What was the treatment intervention that was done? How did I speak to the patient? What kind of rapport did we develop? Like, you reflect on all of that. What could I have improved in this interaction? Oh, I could have asked this question that I forgot to, or oh, I could have started this treatment, or I could have explained this better, or I could have asked the patient about their hobbies. Whatever it is, write that down. Think about it, write it, and so use that to implement for the next patient. And this is what I consider is the level up method of learning psychiatry. And this is stuff that we teach in our program as well. You're not going to learn psychiatry from reading all these books. If you read this book right here, Stalls, like, it's got a lot of great information, but you're not going to learn the nuances of real world psychiatry and patient care. You learn it by reflecting and learning from real patients. So you want to take an active, conscious approach to do this. So that's the core, that's the bread and butter. So then what else do you do? Then you use your learn during downtime. Learn in downtime. And honestly, I think this is, everyone can kind of understand this. This, I feel, makes the difference between an average provider or even a good provider versus an outstanding provider. So I remember when I was in residency, there was the podcast I used to listen to, the Psychiatry and Psychotherapy podcast. And I would have this podcast playing nonstop, like whenever I would drive to work, whenever I'd drive back, when I'd be doing errands around the house, I was just listening to this podcast all day. And that really helped me gain so much more knowledge than if I was just listening to music or just some brain rot content. You want to be learning in your downtime too. So in medical school, for example, we had Anki flashcards, and we would use these Anki flashcards to memorize medications and diseases, pathologies, all the stuff we have to learn in med school. And so I'd be doing the flashcards like if I'm at the grocery waiting, or I'm in line, or I'm in downtime between sets in the gym. It's like I'm taking all that extra time that we have and I'm learning more information. So what I'm doing is I'm aligning. You see how here we're aligning our mind and our actions towards this. That's the whole goal, is that we're aligning. So learning during downtime, right? So podcasts, lectures. So that's what I tell my students in our program is for all the lectures that I have for psychiatry, listen to those continuously throughout the day. Reading, if there's downtime during the clinic downtime, for example, you could always be reading something. So super, super important. And then what else do you do? Then you can also test. So you want to be testing yourself, because now you're trying to learn psychiatry with your subconscious, right? You're using the extra time, not just your main time. And then you can test yourself during the day. So you test yourself, okay, do I remember this medication? How does this medication work? If this patient came in, what would I do in this scenario? If this situation happened, what do I do? Oh, I have this patient coming in tomorrow. What's my plan for this patient? So you test yourself. So you can do this mentally too, all throughout the day, you're starting to test yourself. And what you're doing is you're getting so much more repetition in mentally than the person who's just seeing the patient clocking in and then clocking out. So test yourself. And then lastly, you can teach yourself or teach others. For example, we have Q&A calls in our coaching program every week. And so yesterday we were talking about eating disorders, and one of our PMHNP, she's an expert in that field. She works with that population. And so she was discussing specific nuanced treatment of eating disorders in a case and teaching some of the other PMHNPs there. And even I learned stuff from that. There, what she was doing is now she's doing the highest level of learning. And that's part of the level up method, is now you start teaching yourself or teaching others with it. And so if you want to use your subconscious to do it, you can just do this throughout the day. For example, when I'm planning YouTube videos, or if I'm thinking about psychiatry concept, I think about, okay, how can I teach this to other people? And so when you're trying to teach something to someone else, it forces you to distill it down to its absolute essence and present it in a nice, easy format so the other person can digest it. So if you're trying to explain a complex psychiatric concept like diagnosis of BPD, or how a PTSD patient might present, or how you might treat, I don't know, OCD in pregnancy. So you start, imagine that you're just teaching yourself, teaching someone else this concept. And then when you do that, your knowledge is going to get so much better. And you're going to learn, that's how you're going to go about mastering psych. And I've been observing this too, because now in our program, right, like I think about, okay, how am I going to teach my students? How am I going to teach this topic? On YouTube, I think, okay, like, how am I going to teach this? How am I going to teach that? And so now I'm using my subconscious mind, just like my mind that's kind of chilling during the day, to master psychiatry even more. So I hope this is really helpful, and this is what's going to take you from being a average provider to a great or even outstanding provider. This is part of what I consider the level up method to learning psychiatry. And so if you want to learn more, I would check out our PMHNP Academy. Definitely leave a comment to say how you're going to be learning, how you're going to use your subconscious to master psychiatry. And I'll see you in the next video.